Dr. Lorna Breen was a hardworking ER medical director at New York Presbyterian Allen Hospital. Her family says the 49-year-old was at the top of her game, and then COVID hit.
Patients were dying in the waiting room. It was an unbelievable scene of chaos, and they couldn't get the patients admitted to the hospital fast enough and described that scene as Armageddon to us.
Corey Feist is a healthcare leader and Dr. Breen's brother-in-law.
For the first time in her career, she could not keep up with this pace, and she was concerned that her lack of ability to keep up was going to impact her career negatively. So Lorna really pushed through. She worked 15, 18-hour days, day after day after day, and until a point where she broke.
Dr. Breen committed suicide in April 2020. More than 2 years later, on March 18th, President Biden signed into law the Dr. Lorna Breen Healthcare Provider Protection Act. It allocates over $100 million to train healthcare workers on strategies to reduce burnout and prevent suicide.
After her death, and again in this setting of just this heightened stress and anxiety with the pandemic, I really felt very strongly that we needed to normalize mental health.
Dr. Angela Mills worked with Dr. Breen. Now she works to ensure that medical professionals have better access to mental health treatment.
We partnered with our psychiatry colleagues and started a program called COPE Columbia to be able to offer one-on-one, private, anonymous peer support sessions for each of the members of our group. And we made it an opt-out, meaning we actually just scheduled it for everybody.
The Physicians Foundation surveyed 2,500 doctors last year. They found that more than 60% reported experiencing burnout. That number more than doubled what it was just 3 years earlier. Dr. Mills says she remains committed to normalizing mental health. Corey Feist keeps Dr. Breen's memory alive as a co-founder and president of the Dr. Lorna Breen Heroes Foundation.
It's a significant issue, and in fact, in over 30 states in this country, physicians, and in over 22 states, nurses can have an impact on their license to practice by getting mental health treatment that you or I can get any single day. So this was a significant issue for Lorna that she raised for us. And it's one of the many issues that we continue to work on each and every day.
Burnout among healthcare workers has increased and remains a challenge, which in turn has a repercussion for patient care. So the passing of this bill was certainly important for many reasons and for many people. Mike?